When the Supreme Court allowed the Texas law banning all abortions after detection of a heartbeat, usually about 6 weeks, to go into effect this month, Democratic leaders moved quickly to bring the Women's Health Protection Act to the floor.
This is about freedom of women to have choice about the size and timing of their families.
Democrats say the Texas law is denying women that freedom, sending abortion seekers out of state. Clinics in Tulsa and Oklahoma City have reportedly seen a 600% increase in Texas patients since the law took effect. Women's health advocates now worry the conservative court could use a Mississippi abortion law to overturn Roe v. Wade altogether.
Maybe the most important thing this bill will do is it will end our reliance on the courts.
The yeas are 218, the nays are 211.
Despite passing the House, the bill is very unlikely to make it through the Senate. Still, pro-life lawmakers are concerned.
The legislation overrides past and future pro-life laws, both at the federal and the state level.
Oklahoma's Stephanie Bice is okay with what Texas, Oklahoma, and other states are doing, she says, to protect life. She says this bill is all about taking life.
If signed into law, it would create a national standard to allow for abortions for any reason at any stage of pregnancy, up to birth.
What the bill says is that a viable fetus can only be aborted when, in the good faith medical judgment of the treating healthcare provider, continuation of the pregnancy would pose a risk to the pregnant patient's life or health.
And yesterday, a group of abortion advocates petitioned the Supreme Court to again take up the Texas law, which they insist is unconstitutional. From our Washington Bureau, I'm Oklahoma's own Alex Cameron.